The following video demonstrates how to identify the tip of a catheter when placing a peripherally inserted central catheter, also known as a PICC line, in a lower extremity utilizing Pocus. First, start by selecting the linear probe on your ultrasound machine, as you see in the video. Then, adjust the depth by pressing the highlighted button. This depth will be based on the baby's weight. Now, place the probe over the lower 1/3 of the sternum with the notch at 12 o'clock. You should be able to visualize the vertebral column. The picture on the right is a midline sagittal CT scan of the abdomen and thorax. The letter H represents the heart, the letter L represents the liver, and the vertical red dashed line is the diaphragm. Throughout the video, the red dashed line will represent the diaphragm. The white arrow at the bottom of the screen points to the descending aorta, and the vertebral column is at the bottom of this picture. The picture on the left is an ultrasound image of the same anatomical section. Next, you will need to adjust the gain. Place the probe over the mid-sternum with the notch at 12 o'clock. Then press the highlighted button on the keypad to adjust the gain. These three pictures demonstrate the differences between too little and too much gain. The aim is to visualize the aortic leaflets, heart borders, and heart chambers, as seen in the middle picture. Next, to locate the IVC. As seen in this video, place the probe just below the costal margin at the right midclavicular line with the orientation notch at 12 o'clock. Tilt the probe towards the patient's right side until there is a clear visual on the hepatic portion of the IVC with the catheter inside. The video on the left is a coronal CT scan of the abdomen. The solid yellow line here represents the PICC line in the hepatic portion of the IVC. The video on the right represents an ultrasound of the same anatomical section, showing a PICC line, which appears as a double parallel hyperecho lines on ultrasound in the hepatic portion of the IVC. The catheter should be adjusted so the tip is just below the diaphragm. If the catheter is not visualized, then it is still below the level of the hepatic portion of the IVC. The catheter should be advanced slowly until the tip is seen. If the catheter tip goes too deep and reaches the diaphragm, withdraw it until it is seen just below the diaphragm. The next slides will go over troubleshooting in case visualization of the hepatic portion of the IVC or the PICC line is not visible. The blue rectangles represent the location of the probe. These pictures demonstrate the differences between a too high, a good location, and a too low probe for positioning. As demonstrated by the middle picture, the entire screen should be occupied by the liver. If the probe is positioned too low, as it is on the left, the intestines will obstruct the view, and if it is positioned too high, as it is on the right, the lungs will obstruct the view. When the PICC line is not visible, switch to the sector probe. This may be needed with bigger babies. Again, the gain and depth will need to be readjusted. This picture illustrates an ultrasound of a PICC line, which appears as a double parallel hyperechoic lines in the hepatic portion of the IVC using the sector probes. This final video illustrates an ultrasound of a PICC line, which appears in the proper position in the hepatic portion of the IVC while using the sector probe.